Wait.
Good morning, everyone. Welcome to our February edition of Let's Talk About It. And today we're going to talk about congenital syphilis. That's a mouthful. A little bit about syphilis first. It's one of the oldest known sexually transmitted infections, and it's been known to afflict world leaders over the centuries, for example, Henry VIII. It has been known by many names over the years. Sometimes was called the pox, sometimes luz, and had a lot of nicknames. Syphilis is a bacterial infection which means it can be treated with the proper antibiotic, and it can cause significant problems in adults that have it. But the main reason we're here today is talk about congenital syphilis. The word congenital means born with. So I'm going to talk about syphilis in pregnancy and congenital syphilis, or babies born with syphilis. Syphilis, just to back up a little bit, syphilis can be acquired through sexual transmission. It has several different stages, and a lot of times people hear about syphilis stages. And I'm not going to get into a lot of that, but what I do want to say is that during the first year of infection is when people can give the infection to someone else. Syphilis can have some serious and obvious signs and symptoms, but frequently people have the infection and don't know it, either because they don't recognize the symptoms or because they don't actually have them, because 2/3 of the time people don't have most of the symptoms of syphilis. So I want to talk then about pregnancy. So just like any other person, sexual contact can occur during pregnancy in the same way that occurs in people who are not pregnant. And the symptoms that can occur, as I mentioned, are wide range, including the initial stage chancre, which is not to be confused with canker sore, like the common sores that people get in their mouths from eating foods that don't agree with them. The chancre is highly infectious, and it's a sore in the area where the syphilis entered the body. So frequently in the genital area, could also be in the mouth or around the anus. And it can occur through oral sex, vaginal, penile sex, or rectal sex. As I mentioned, there are stages, and the signs and symptoms of the next stage, called secondary, is a whole list of possible rashes, and there can be sores in the mouth, there's sores in the genital area, wart-like lesions, and these can present in about 1/3 of the people that have syphilis, but as mentioned, 2/3 may not have them. In all cases, the sore and the rashes and the other sores or wart-like lesions will all go away whether treatment happens or not. Treatment will make them go away faster, but so many times people might see that they have some kind of vague symptoms, but they don't bother getting treatment because those things go away, like I said. Anyway, so let's talk about syphilis in pregnancy. So like any adult, a woman who becomes pregnant can have some illness related to syphilis, including some serious illnesses that can affect the eye or the brain, just like in any other person. But the big problem with syphilis in pregnancy is the effect on the baby. The germ that causes syphilis, called Treponema pallidum, can cross the placental barrier or transplacental infection. And so at any point during pregnancy, at any stage of syphilis, a pregnant woman could pass the infection onto the fetus by way of this crossing the placental barrier. So it can cause problems in the developing fetus, and that would mostly lead to some problems that will show up at birth, but also there is stillbirth that can occur. And very often that stillbirth will occur somewhere at about 6 months gestation. For the babies that get born with syphilis, which we would then call them having congenital syphilis, the signs and symptoms then that can occur in the serious complications include, first of all, death after the child is born, deafness or loss of hearing, neurologic impairments including meningitis and infection around the brain and around the spinal cord, which may not show up at birth but sometime during the first year of life, often at about 3 to 6 months. Hydrocephalus, sometimes called water on the brain. Facial nerve dysfunctions, where there can be a lack of ability of certain nerves in the head to operate, and we might call them palsies. And also importantly, intellectual and developmental deterioration. There can also be a stroke. And there can be a bunch of different bone deformities which can lead to problems with mobility. So syphilis, for about the last 20 years, has been primarily occurring in the U.S. And elsewhere in men who have sex with men. And we use the abbreviation MSM. And so while those men have been giving syphilis to each other in different sexual kinds of encounters, if it's confined to men, we don't have to generally worry about congenital syphilis. However, in the last 5 years, we have seen this gradual rise in congenital syphilis, which means we are talking about women who are infected. Many men who do have sex with other men do have sex with women, but we also know that this infection is starting to happen more for heterosexuals. We haven't seen a rise in congenital syphilis like this since the late 1980s and early 1990s, when we were able to effectively just about eliminate syphilis among many people in the United States. The rates were very low. And here in our county, we're based in Monroe County, we were down to just one case of syphilis in 1999. However, as I mentioned, for about 20 years, starting around 2000 or 2001, it started to rise among MSM. As noted in the last 5 years, however, it's been a problem with women. And the increase in syphilis in women has been 143% over the last 4 years. In terms of congenital syphilis, the diagnoses increased 167% in 2017 compared to the average number of annual diagnoses from 14 to 16. Early New York State data tells us that this is a concerning and an obvious trend, and that there's concern about it continuing. I already told you some of the things that can happen from congenital syphilis, but what we do want to say is that it's important for women to get tested. And I just want to tell you a little bit more about the number of cases of congenital syphilis in the country in 2017. Nearly 1,000 cases were reported. That is not a lot in the context of all of the sexually transmitted infections in the people in the United States. But the problem is that if a woman has syphilis, it can lead to congenital syphilis. And there have been 64 stillbirths reported related to syphilis in 2017 and 13 deaths. And that represents nearly 45% increase in infections. The New York State Health Commissioner, Howard Zucker, sent out a health alert to healthcare providers last July, encouraging people to be more clear about understanding the risk that we are seeing due to the rise in congenital syphilis. In addition, the health alert went to health providers to say you need to be testing more frequently and you need to be discussing risk with your patients. And so the guidelines around testing, I'll just tell you, is during pregnancy is in the first trimester ideally, Now they're saying it's wise to test in the third trimester as well, because sometimes syphilis tests will be negative initially in the infection, and it may take a few weeks before the test would be positive. For women that have ongoing risk, that would, some recommend doing testing through all 3 trimesters. Now, syphilis testing is a blood test, and it has different layers and guidelines that providers have to use. But for consumers, what we want you all to know is that if you're pregnant or considering pregnancy, get tested for syphilis and other sexually transmitted infections, including HIV. And once you're pregnant, be sure that your provider is conducting syphilis testing for you. If you have ongoing risks such as more than one partner, or perhaps a partner who is substance using, particularly opioids or cocaine, you might want to suggest to your provider that you get tested at least one more time during the pregnancy. And as stated, these are the current recommendations. I can show you some graphs about the rise in congenital syphilis, but what I just want to point out is that it's on the rise, and we know that it's related to a rise in syphilis among women. But syphilis is preventable, and syphilis can be prevented by the ways you already know. Mutual monogamy, meaning just 2 partners, just with each other. But there's a little more to that, and that is that they both get tested in the context of the relationship, and frequently we would recommend repeat testing from the beginning of the relationship into about 3 to 4 months later, because some tests are not always initially positive. And so that's the way to prevent it. Of course, there's also condoms, and condoms are very effective, but they don't cover all the areas where that chancre, that sore that happens in primary syphilis can occur. Everybody gets a chancre, so one way you could assess that is to actually look at the genitals of yourself and your partners. And then, of course, there's always no sex. But congenital syphilis is further preventable, not presentable, because we talked already about women getting tested. For pregnant women, as mentioned, at least in the first and third trimester, and some recommend all 3. Mothers are to be tested again at birth. They don't test the babies because the babies will have the mother's antibodies, so they need to test the mothers at birth again. Any babies born to mothers known to have syphilis need to be treated for syphilis, and they need to be closely monitored for any signs of complications through the next few years. And syphilis is treatable, and I told you at the beginning that it's a bacterial infection and can be cured. And the treatment is a particular type of penicillin, only given by injection or through an intravenous infusion. There are no penicillin pills that can take care of and cure syphilis. But no one's going to know if they need the penicillin if they don't get tested. So we urge you as a consumer to get tested every year, every 3 to 6 months, depending on your life circumstances and sexual partners. And if you are considering pregnancy, or if you are pregnant, please assure that you get tested. Some credible sources for STI information include the CDC, which is www.cdc.gov, and also the New York State Department of Health website, much longer. It's www.health.ny.gov. And we also encourage you to look at the CEI, or Clinical Education Initiative, website, which is CEItraining.org. I was going to say gov, and I would have been wrong. And our website for the Center for Health and the Center for Community Practice is www.urccp.org. The Clinical Education Initiative is funded through the New York State Department of Health, and they are sponsoring this FaceTime, let's talk about it session, and they are funding the Center for Community Practice to be the Sexually Transmitted Disease Center of Excellence for New York State. CDC has some good information on congenital syphilis also.
Thank you.
No questions?